Hi, my name is Deva Nugraha with student number 21015411160 from G class. I am a student of the Bachelor of English Department, Faculty of Humanities, Udayana University. And this is for the video project for intermediate listening lesson assigned by Novita Mulyana SS MHU.
Hi folks, first of all let me introduce myself. My name is Putu Ersta di Lunga Atmaja with 4 last digit number 1155 from G class. Today we will present 4 materials such as explanation of endemic, indicators of pandemic becoming endemic, current conditions, and opening of tourism. Here I will explain what is endemic. In the 2 years since SARS-CoV-2, the virus that causes COVID-19 began rapidly circulating across the globe, many people have had to learn a new vocabulary. It's one of pandemics and antibodies, rapid tests, and vaccination rates. But as the pandemic has continued, another word has been added to the collective lexicon, endemic, with the virus unlikely to disappear. Global health experts want people to think of COVID-19 as an endemic disease, not a pandemic. In other words, it's a disease that's always going to be around, not one for which there's a definite end. What does the endemic mean? The Centers for Disease Control and Prevention, CDC, says an endemic trusted source is the constant presence and or usual prevalence of a disease or infectious agent in a population within a geographic area. To put it another way, an endemic disease is consistently present, but it spreads at predictable rates that can be managed by communities. These rates may be higher than desired levels. However, currently the infections with SARS-CoV-2 and the resulting COVID-19 disease remain very high across the United States and the world. But the number of new cases each day is beginning to stabilize. There is one sign the pandemic may be transitioning to endemic status. Examples of endemic disease. Influenza, also known as the flu, is a good example of an endemic disease. Despite vaccinations and effective treatments, the flu has a constant presence in the global community. In fact, the CDC says 12,000 to 52,000 people trusted source die annually from the flu in the United States. In parts of the world, malaria is considered endemic. In the United States, it's nearly eradicated because of safety measures such as screens on doors and windows.
My name is Anisa Dwi Darmiyanthi with student number 21015411171 from G class will report about what indicators are being carried out for the pandemic to endemic transitions. The endemic transition is a process in which the period from pandemic to endemic. Siti Nadia Tarmizi explained that there are several indicators so that this pandemic can decrease its status to endemic, including the rate of transmission of this virus must be less than 1, the positivity rate must also be less than 5%, the hospitalization rate must also be less than 5%, the facility rate must be less than 3%, and PPKM level is at level 1 local transmission. This condition must occur within a certain time span for 6 months. Of course, the indicators and timing are still being discussed by the government together with experts to determine the best indicators for us to actually achieve endemic condition. Certainly, Indonesia is in the process of transmission from a pandemic to endemic. The transition process is in line with the easing policies decided by the government. The easing was carried out by lowering the PPKM level to level 2, eliminating antigen and PCR as a condition for domestic travel using sea, land, and earth transportation for people who had been vaccinated up to the second dose. The World Health Organization also clarifies about what a condition of the disease is when it becomes the pandemic. Executive Director of WHO, Dr. Ryan, said that even when it becomes endemic, the virus can still cause seriously illness and death. When endemic, the virus persists and transmits to a lesser extent, usually with some form of seasonal transmission on or seasonal increase or outbreak over an endemic situation. However, even though the transmission is lower, Dr. Ryan also explained the COVID-19 can be still highly caused.
My name is Andrea Tantri Novembrian. My student number is 2101541152. I'm from G class, and now I will report about the world's condition now after pandemic. We all know that pandemic is really harmful for all of us. It really affects on our world's economic, tourism, and also people's mental health. And all of us have asked the same question since 2020, like when will this pandemic end? And we never know the answer until now. But finally, in 2021, WHO or World Health Organization launched the vaccine. And it's free, so all people should do the vaccine. And after people having their vaccine for 3 doses, the world will become endemic soon. But it's not that easy as expected. Some people don't want to be vaccinated because of some reasons that not make any sense. So right now, wherever place you are going to, they will ask for your vaccine certificate. And that's the beginning of the pandemic. But still, WHO is warning us about COVID-19. It's not over yet. But it will get better because people will try to live with the COVID-19 just like any other disease, such as flu, and people gain more immunity against the virus through the vaccine. So people need to live with the habit when we are still in the pandemic, like keep our body healthy with vitamin and make sure we clean our body. So the world's condition now is people are trying to live with COVID-19, and the pandemic will become an endemic soon. So the world's economics is starting to get better too, and we just need to be patient and keep our health protocols so we can live freely without COVID-19 and live just like we used to and be happy again. Thank you.
Minister of Tourism and Creative Economy Sandiaga Salahuddin Uno is optimistic that foreign tourists will return to visit Indonesia, following a number of the government's led policies in the transition towards a productive and safe society due to COVID-19. He said one of the impacts due to the COVID-19 pandemic was the decline in foreign tourist arrivals from the end of 2019 and in 2021 to less than 6.5%. Sandiaga explained it when he was a speaker at virtual media briefing agenda at Putu, deep dive into safe COVID-19 tourism, with the government spokesperson for handling COVID-19, Professor Wiku Adhisa Smito, Thursday, 10th March 2022, which was also broadcast on the Presidential Secretariat's YouTube channel. We believed this policy change, especially in Bali, Batam, and Bintan, is enthusiastically welcomed by foreign tourists. It will be successful if we continue to focus on very strict and disciplined health protocols that integrate the application of the Peduli Lindungi application, said Sandiaga. He said Indonesia is now appreciated by foreign tourists. One of them is because foreign tourists not only need 30 minutes to go through the entrance process at the arrival gate. In fact, satisfaction is also felt with the service provided by the hotel and its staff. And also, the handling continues to be improved on visas and other facilities to attract foreign tourists. Furthermore, regarding Batam and Bintan, Indonesia is now receiving many requests from Singapore, and this can be seen as an opportunity for many tourists to come to Batam and Bintan. Then, the Bali warm-up holiday programs was quite successful, with a low impact on COVID-19 transmission, with a positivity rate below 0.5% based on the entrance test February 22, 2022. Annually, 1,500 foreign tourist arrivals were recorded. Currently, the government, through all ministries or agencies, is making better preparation for foreign tourists visit who will participate in the G20 summit and various other international events, including the agenda of the United Nations Office for Disaster Risk Reduction, which is planned for next May. Sandiaga added, in providing the best service to foreign tourists who visit, his party cooperates with the relevant stakeholders, and the facilities offered have been equipped with clean, healthy, safety, and environment (CHSE) or certification, and the implementation of health protocols, so that tourists who are on vacation can carry out their activities safely and comfortably while in Indonesia. In addition, with conditions continuing to improve, Sandiaga sees the potential for an increase in the visit from abroad this year, in the range of 1.8 to 3.6 million foreign tourist visits. Then this year, there is the potential to open 34 million jobs in the tourism and creative economy sector. In order for this to be achieved, the Ministry of Tourism and Creative Economy, together with the other government officials, must prioritize health protocols to be applied in a disciplined manner in the Indonesia tourism sector. Looking at the last developments, the peak of cases due to the Omicron variant was passed on 20 February. Positive cases continued to decline after about 1 month of sharp increase in weekly cases approaching 400,000 cases. But in just 2 weeks, we managed to reduce it by almost half to 200,000 cases. This number is still high, so it is our joint task to ensure conditions return to the before the peak, which is around 1,000 cases per week, explained Wiku. Unfortunately, the government's vaccine data processed by the World on the Our World in Data website as of March 6, 2022, only reached 53.5% of the population at the full dose. Meanwhile, people with dose 1 reached 69.48%, or almost 70% of the total of population. We should be grateful Indonesia has surpassed the achievement of the first dose of vaccine in the midst of world achievement. I am Ngakan Gede Deva Nugraha. Thank you and see you again.